We're now joined by Mark Dinglasan, who is Executive Director of CUMAC. Good to see you, Mark.
Good to see you, Steve. Thanks for having me.
I want to make sure that I said your name correctly. If I'm not, just correct it.
It's Dinglasan.
Thank you. Appreciate that. Let me ask you this. Your organization is called by many, an anti-hunger organization. You're that, but you're so much more, correct?
Correct.
Describe it.
Sometimes when people first hear of CUMAC, they say, oh, you're that food pantry in Patterson. And then we then tell them we're an anti-hunger organization. And then where the so much more comes in is people then ask me, what does that mean? And an anti-hunger organization is an organization that believes that ending hunger has nothing to do with giving people food. It believes that wrapping services around individuals and families so that one day they don't have to come to you for food should be the fixed point that we're working towards. And that's how you effectively address and hopefully one day end hunger.
You know, the other piece of this very complex set of issues that you and your organization are tied to and committed to has to do with childcare. And you came to us through our friends at the Terrell Fund. There's an initiative called Reimagine Childcare. We initially had a series, we're doing a long-term series called Right from the Start, NJ, all about quality and affordable childcare. What is, as it relates to Reimagine Childcare and the need for better quality, affordable, accessible childcare, how does that relate to the work that you and your colleagues do?
That's a great question. And it's something that we get a lot, actually, because they always say, why does the food guy and the food organization care about childcare? For us, Steve, one of our biggest focuses as an anti-hunger organization is adverse childhood experiences, right?
ACEs.
Correct. Right. And adverse childhood experiences are a series of negative events in childhood, right? And when you chronically experience that, it turns into toxic stress, which drastically affects the way a child develops, the way an adult learns, lives, and grows in their community, and the way a community grows. So where that all ties together is when ACEs research was first developed, one of the main things that Dr. Anda and Dr. Folletti, who were the people who executed the first ACEs research in 1998, one of the main points that they emphasized that we hammer on at CUMAC is that in order for us to truly get people to a better place and truly address ACEs, we have to alleviate the burden of health on parents and caregivers. And that burden of health is, can you access fresh, healthy food? Can you cook breakfast the next morning for your kids? Can you find a job? Are you able to hop on a computer to find a job? Are you able to access healthcare? If we don't alleviate that burden of health, if we don't give parents and caregivers the support that they need, right, it becomes harder to create healthier communities. And that's our tie-in to childcare and childcare efforts that you're involved in, because we are food and food is medicine for the communities.
You know, it's so interesting. And you talked about, Mark, how not only how complex these issues are in terms of helping those who are most vulnerable, particularly our children, but from a public policy point of view, you ever notice that legislation or policy initiatives are often, they're narrow, right? We're going to do this for this particular issue. We're going to solve that problem, as if these issues are not multifaceted and multifactorial, if you will. I don't want to get overly complex or get on my soapbox, but what you just described is the reality. And so legislation that does this doesn't address this. Fair?
Fair.
Well, to that end, it's interesting. Your organization, people often say, you give people food. Go back to the thing you said, food is what? You say medicine?
Food is medicine.
Make that case.
We often talk about one of the main things that you hear in the nonprofit sector, even prior to this pandemic, right? We talked about social determinants of health, right? And the things that actually make people healthy. If you look at research for social determinants of health, food accounts for about 25% of one of four major factors for social determinants of health, right? But but you have to be able to connect the food that you're giving to people, to the health of that person and to the health of the community, right? That's why it's called social determinants of health. So
that's right.
For those of us that are in food pantries, food banks, anti-hunger organizations, if we truly believe food is medicine, right, we would take a long, hard look at the food that we're pumping out. One of the more traditional views of food banking, emergency food, food pantries is, oh, you know, I want to empty out my cupboard, or let me grab what's cheapest on the shelf and give that to the canned food drive. But if our fixed point was actually food is medicine, and we want to make people better, and we want to make communities better, right? It changes the entire perspective of what food can do, right? Because we know how not only it will affect a child, a mother, a father nutritionally, but we know what it'll do to their psyche, to their idea of dignity, to the empowerment you can give a mom, knowing that she can make breakfast the next morning for kids. We have to look at this holistically, right? If we truly believe in social determinants of health, and if we truly believe in ending hunger, then this goes beyond just giving the cheapest can of beans that we can find.
Very well said. And that is, in fact, why this Reimagine Childcare Initiative is so important and why we're involved in it. Mark, I want to thank you so much for joining us. We appreciate it. Wish you and your colleagues at CUMAC all the best.
Thank you so much for having me.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, the Healthcare Foundation of New Jersey, the Turrell Fund, supporting Reimagine Childcare, the New Jersey Education Association, PNC, Grow Up Great, the Northward Center, the Robert Wood Johnson Foundation, the Russell Berry Foundation, and by the Fidelco Group. Promotional support provided by bestofnj.com and by the New Jersey Business and Industry Association.
The essence of the Northward Center is ingrained in our values, thoughts, and actions. What began as a storefront on Bloomfield Avenue has evolved into a life-changing community nonprofit. The mansion is steeped in tradition, but with all of its grandeur, the true essence of the Northward Center is in the people we serve. So as the Northward Center commemorates 50 years of service, let's also celebrate the many opportunities yet to come.